Both humans and nature can coexist. It just requires little creativity from our side so that the tree, the nature, and the human being, the car, can both coexist. Now, the types of the psoriasis, there are about 8 types of the psoriasis. One is plaque psoriasis, the gut-type psoriasis, erythrodermic psoriasis, inverse psoriasis, pustular psoriasis, seborrheic-like psoriasis, napkin psoriasis, and mouth psoriasis. So the first is plaque psoriasis. It is also known as psoriasis vulgaris, chronic stationary psoriasis, or plaque-like psoriasis. It is seen in 90% of cases. There is dry red, raised area of inflamed skin patches, which is called psoriatic plaques. These are covered with silvery white, scaly skin. These are few or many itchy and they are painful. They are seen at elbow, knees, scalp, back, genitals, and soft tissue inside the mouth. But they can occur anywhere on the body. Number 2 type is the gut-type psoriasis that primarily affects young adults and children. It is triggered by a streptococcal infection in throat or perianal region and occurs 1 to 3 weeks post-infection of these areas. And gutted psoriasis is an inflammatory condition that presents with numerous small, scaly red or pink droplet-like lesions which are called papules. These numerous papules appear over large area of the body, mainly on the trunk, limbs, and scalp, but spares palms and soles, which are not having this kind of lesion. The lesions are covered by a fine scale and are not as thick as the typical plaques are seen otherwise. One may have a single outbreak or may have repeated episodes of this type of lesions. Number 3 type is erythrodermic psoriasis. It is also called psoriatic erythroderma and it is least common type and it involves when it is there about 90% of the body surface area. So here one can see the plaque psoriasis. The plaques are seen on the leg, on the arms, and on the back of the chest. So these are many small scaly lesions. So that's called plaque psoriasis because of them. And here one can see the number of small papules and these are present on the back of the buttock, on the chest, on the arm and any area of the body, and that is called gutted psoriasis because of their appearance like small papules are present. Now, the third variety, as I have told you, that is erythrodermic psoriasis. It involves the widespread inflammation and exfoliation of the skin over the large body surface, and there is red, peeling, rash, cause severe dryness, itching, swelling, burning, and pain. It can develop from any of the other type, that is from an exacerbation of unstable plaque psoriasis that is not being controlled well by treatment, or after abrupt withdrawal of the systemic glucocorticoids. It can be fatal as extreme inflammation and exfoliation disrupt and disturb the body's ability to regulate temperature and to act as barrier function, which is the normal function of the skin. Number 4 type is inverse psoriasis. It is also known as flexural psoriasis because it is seen mostly in the flexure. It appears as smooth, inflamed patches of the skin. These are red, worsen with the friction and the sweating. As one can see the erythrodermic psoriasis, as one can see the red area because of this psoriasis, and here one can also appreciate the red area of the skin on the front of the chest and also seen on the back of the chest. Here one can see the inverse psoriasis, that is at the flexural surface of the body, as one can see under the breast and behind the ear and between the buttocks and here between the legs. So all the flexural surface of the body can be involved in this inverse psoriasis. And inverse psoriasis, the patches affect the skin fold I have already shown you around the genitals, between the thighs and the groin and the armpits. Skin folds of the overweight abdomen called caniculus, between the buttocks in the intergluteal cleft and under the breast in inframammary fold. Heat, trauma and infection causes this atypical form of psoriasis, and here one can again see the area which are involved in this inverse psoriasis. Number 5 is the pustular psoriasis. It is rare as widespread patches in the smaller area of the hands, feet and the fingertips. They develops quickly as pus-filled blisters filled with non-infectious pus or the pustule. So the name is pustular psoriasis. The skin under and around pustule is red and tender. And pustular psoriasis can cause fever, chills, itching and diarrhea. It is either localized or widespread throughout the body. There are 2 types of the localized pustular psoriasis. These are psoriasis pustulosa palmoplantaris and acrodermatitis continua of the halopu. Both forms are localized on the hands and feet, as their names are palmoplantaris and acrodermatitis, so they are restricted to the hands and feet. Number 6 is seborrheic-like psoriasis. It is a combination of psoriasis and seborrheic dermatitis. There are red plaques with greasy scales in area of the higher sebum production, scalp, forehead, skin folds near the nose, skin around the mouth, skin on the chest, above the sternum. The areas which are usually involved by the acne are also the area that is being involved by the seborrheic-like psoriasis. So here one can see the pustular psoriasis, one can see the pustules, many pustules on the hands and many pustules on the feet, and that is why this is called pustular psoriasis, and one can appreciate that. And here it can be like the seborrhea, as the seborrhea is also looking like this. So that is the type of psoriasis which looks like seborrhea. So that is why it is called seborrheic-like psoriasis. Now the 7th type is napkin psoriasis. It is a subtype of psoriasis common in infants, present with red papules with silver scales in the diaper area. For that it is called napkin psoriasis. That it may extend to the torso of the limbs from the diaper area, and it is misdiagnosed as napkin dermatitis or the diaper rash. Number 8 type is mouth psoriasis. It is rare papulosquamous disorder that involves both skin and mouth. When oral mucosa is involved, it is usually asymptomatic lesion or appear as white or grey-yellow plaques. And fissured tongue is the most common finding in the oral psoriasis, and it is seen in about 6.5 to 20% of cases. Geographic tongue, which is migratory stomatitis, appear very similar to this mouth psoriasis, but there is no link between the two conditions. Here one can see the napkin psoriasis at the area of the dapper, and sometimes it is misdiagnosed as the dapper rash, but it is the napkin psoriasis. And here one can see the fissured tongue and the area of the mouth which is involved by the psoriasis, and one can get this psoriasis in the mouth also. Now, the classification of the psoriasis, that is pathogenetic. Another classification scheme considers genetic and dermographic factors. So the classification is type 1 has a positive family history and it starts before the age of 40, and it is associated with human leukocyte antigen HLA-CW6, and it accounts for 70% of persons with psoriasis. Type 2, it has got no family history and it usually presents after the age of 40 years, and it is not associated with HLA-CW6. Now, the diagnosis of psoriasis, it is based on 4 parameters. Number 1, history and physical examination, blood test, imaging, and skin biopsy. First, the history and physical examination. History of any other associated or the underlying disease, and also note the family history of that patient. Physical examination of the skin, scalp, and nails, especially that show scaly erythematous plaques, papules, or patches of the skin which are painful and itchy. Specific medical signs also assist with the diagnosis. These are Auspitz sign, that is pinpoint bleeding if the scale is removed, and the other sign is Koebner phenomena, that is psoriatic skin lesions are induced by the trauma to the skin. In the diagnosis, the second parameter is the blood test like CBC, ESR, and C-reactive proteins are helpful. Number 3 is the imaging. It is done only, the X-rays are used if there is psoriatic arthritis. And the number 4 is the skin biopsy, that is under the local anesthesia, skin biopsy is taken and one have to see under a microscope there are club epidermal projections that interdigitate with the dermis, and there is epidermal thickening on skin biopsy. Stratum granulosum of the epidermis is missing. Cells from most superficial layer of the skin are abnormal, and there are inflammatory infiltrates also seen. And here one can see the thick plaque psoriasis. There are parakeratosis and hyperkeratosis. There is loss of stratum granulosum there, and there are tortuous capillaries in high dermal papilla, and the neutrophils in the dermal papilla sometimes invading the epidermis, and there is acanthosis, and the clubbed rete ridges are also seen on skin biopsy. Now, coming to the differential diagnosis, there are, one have to differentiate it from the other diseases which are discoid eczema, seborrheic eczema, Psoriasis rosea, which is usually confused with the gutted psoriasis, and ringworm tinea is also giving the confusion. Tinea fungus is confused with the nail psoriasis, and there is cutaneous T-cell lymphoma because 50% of these are misdiagnosed with the psoriasis, but actually that is cutaneous T-cell lymphoma. Then the rash of the secondary syphilis is also confusing, and there is confusion with the lichen planus. Here one can see the discoid eczema, that is also called pulmonary dermatitis, then seborrheic dermatitis, and that is also giving like the psoriasis, then Psoriasis rosea, and the ringworm, then nail fungus, as one can see, these are having the changes like psoriasis, and there is cutaneous T-cell lymphoma, there is red dry skin, and there is patches are there also, and the ulcer-like tumor that is being confused with the psoriasis. Then secondary syphilis also give the appearance like psoriasis, as one can see the scales and the lichen planus. If you want to see the unity that is being seen in the small birds, small parrots which are sitting on the same branch and very amicably and very comfortably, but the human beings can't sit like this. Now, coming to the treatment of psoriasis, the main goal of the treatment is to stop the skin cells from growing so quickly. There is no known cure for psoriasis, but the treatment helps control the symptoms. So the treatment consists of 6 parameters, that is topical treatment, phototherapy, systemic agents, biologics, natural remedies, and surgery. Number 1 is the topical treatment, that is for the mild disease, as the psoriasis mainly affects the skin. Topical treatments are very useful, safe, quite effective, and applied directly to the disease. So here one can see the schematic of psoriasis treatment ladder, that is first we have to give the topical corticosteroids and calcipotriol and anthralane and the coal tar, and in the second phase we use the phototherapy, that is PUVA and ultraviolet B, and then we use the systemic agents. These are the biologics, cyclosporin, methotrexate, and the retinoids. Now, the topical treatment is for the mild disease, as the psoriasis mainly affects the skin. Topical treatments are very useful, safe, quite effective, and applied directly to the disease. It reduces inflammation, skin turnover, remove the built-up scale, clear the affected skin of the plaques. 75% effective when used as creams, ointments, gels, lotions, foams, and shampoos. If less than 10% of the body surface is involved, these are very effective. The use of the fingertip unit is helpful. So, topical corticosteroid use very potent only, like desoxymetasone, fluocinolone, clobetasol, difluoroalazone, like this compound. Long-term use can cause thinning of the skin. The second one is a topical treatment is vitamin D analogs. These are calcipotriene, that is Davonex, or calcitriol, that is Vectical, or pericalcitol. These are being used. And here one can see that's oxymetasone 0.25%, fluocinolone cream, and clobetasol propionate, and then difluorasone, then calcipotriene ointment, and that is calcitriol ointment. These can be used accordingly. Continuing the topical treatment, vitamin D analogs, pericalcitol, are superior if combined with a very potent steroid. Vitamin D is superior to coal tar. Then anthraline, it slows the skin growth, removes the scale, but irritates skin and stains anything that come in contact with that. Then there is calcineurin inhibitors, that is tacrolimus and pimecrolimus, reduce inflammation and the plaque built up for thin skin around eyes. Then salicylic acid, it promotes sloughing of the dead skin cells and reduces the scaling combined with the other medication. It is available as shampoos and lotions. Coal tar, it is derived from the coal, reduces the scaling, itching and inflammation, irritate the skin, stains clothing, and available as shampoo, cream and oils. So here one can see the anthraline and topical calcineurin inhibitor, that is pimecrolimus cream, and then salicylic acid, shampoo, coal tar, and here is the coal tar that is available as topical lotion or as shampoo. Now, continuing the topical treatment, the topical retinoids, vitamin A derivatives, decrease the inflammation. It is used as oral also. Moisturizer, apply immediately after a bath or shower. It includes mineral oil, petroleum jelly, calcipotriol, and ducubal. Coconut oil as emollients can be combined with phototherapy, balneotherapy, or climatotherapy. It is the daily salt bath in the Israel's Dead Sea, plus graded solar exposure and application of the crude coal tar. The Dead Sea balneophototherapy is a combination of salt baths and exposure to the ultraviolet B light, UVB. It is better than ultraviolet B alone. It is also effective for psoriatic arthritis, but it has many side effects like folliculitis, sunburn, poikiloderma, actinic elastosis, or the liver spots. So here one can see tretinoin, and that is moisturizing cream, that is balneotherapy, that bath and with coal tar, and then there is the Dead Sea climatotherapy, and that is Dead Sea spa salt, which are being used after the bath. Number 2 treatment is the phototherapy. One can use natural or artificial ultraviolet light. Best is sunlight, or use artificial ultraviolet light A or ultraviolet light B light, either alone or in combination with medication. For more extensive disease, all ultraviolet light causes mutation, so there is chance of skin cancer. Most popular is narrowband ultraviolet B, that is different from ultraviolet A, as small portion of the ultraviolet light spectrum is used, which is beneficial, and it is less carcinogenic. This narrowband ultraviolet B therapy is similar in efficacy to psoriasis and the ultraviolet phototherapy, and that is called the PUVA therapy, but it is more convenient. Laser therapy, here laser produces ultraviolet light in wavelength similar to the narrowband ultraviolet B light. Then Gokerman therapy, that is ultraviolet B treatment plus Coltral. Here one can see the light therapy for the psoriasis by the different ways, different machines are used, and here is also the light therapy, and there is the laser treatment for this psoriasis. The photo tells that sometime the love begins at the very early age, as one can see in this photo. Now, the treatment continued. Number 3 treatment is systemic agents, that is for the psoriasis resistant to the topical treatment and phototherapy. So systemic agents are used. They act by targeting portions of the immune system. Patients with the pustular or erythrodermic psoriasis or associated arthritis need systemic therapy from beginning of the treatment. Non-biologic drugs are cyclosporin, methotrexate, hydroxycarbamide, fumarates as dimethyl fumarate, and retinoids. Acetretin, soriatin is similar to vitamin A. Most drugs affect liver, kidney, bone marrow, so do regular blood and liver function test to see the side effect of these medicines. Majority of the people experience a recurrence if systemic treatment is discontinued. Anti-streptococcal medications may improve gut ache and the chronic plaque psoriasis. So here one can see the cyclosporin, the methotrexate, hydroxycarbamide, dimethyl fumarate, and tretinoin capsule, acetretin capsule that can be used as the systemic agent. Number 4 treatment part is biologics. It's a new class of drugs as living cell synthesize them. These are proteins, so cannot be given orally but by injection, subcutaneous or intravenous injection. They are very precise in their target and block a single step in the immune process. Unlike methotrexate, these are well tolerated and safe for the long-term use in plaque psoriasis. Due to their immunosuppressive actions, biologics have the risk for the infection. These are the third-line treatment if no response to the topical treatment, phototherapy, and non-biologic systemic treatment like methotrexate or cyclosporin. Several monoclonal antibodies target the cytokines TNFA like infliximab, adalimumab, golimumab, tocilizumab, pegol, and etanercept. These are the monoclonal antibodies which are being. So here one can see infliximab, and that is adalimumab, and that is golimumab. Then there is tocilizumab and etanercept, and that is ustekinumab. So continuing the biologics, ixekizumab act on the pro-inflammatory cytokines. It inhibits inflammatory pathway differently than anti-TNFA antibodies. FDA approved ustekinumab and guselkumab for the plaque psoriasis. Others are that target T cells or eflezumab, and elifacept. Bimekizumab, brodalumab, razanikizumab, secukinumab, and apremilast are also used sometimes. Anti-IL, anti-IL-17, anti-IL-12, anti-IL-23, anti-IL-23, and anti-TNF alpha biologics are more effective. Psoriasis patients may develop neutralizing antibodies against monoclonal antibodies. And here one can see ixekizumab injection and guselkumab, then bimekizumab and brodalumab and razanikizumab and secukinumab and apremilast. These are the compounds. Now, the fifth is sometimes being used, that is our natural remedies. Natural solar spectrum have ultraviolet light. There is an increased body mass is associated with the psoriasis. So keep a normal body mass, use the diet low in saturated fats, climatotherapy at the edge of the Israel's Dead Sea. Certain resorts cater psoriasis patients using combination of graded solar exposure and application of the crude coal tar. Lifestyle measures, use of the moisturizer, quit smoking, alcohol, and stress reduction are also helpful, as the psoriasis is stress inducer, so do stress reduction. Fish oil rich in icosapent, tannic acid, EPA, and docosahexaenoic acid, DHA, are also helpful. And continuing the natural remedies, cold water fish like salmon, herring, extra virgin olive oil, legumes, vegetable fruits, and whole grains are also helpful. Avoid the red meat, dairy products due to their saturated fat, caffeine, and sugar. Take probiotics and oral vitamin D. High rates of the celiac disease in the psoriasis and those with the anti-gliadin antibodies seen. So if on a gluten-free diet, disease severity decreases in people with celiac disease. And the sixth is the surgery. Removal of the tonsil is beneficial in chronic plaque psoriasis, gutted psoriasis, and palmoplantar pustulosis. And here one can see the psoriasis before treatment or after treatment. Similarly, before treatment and after treatment. And here also on the legs, before treatment and after treatment. And on the arm, before treatment and after treatment. So the prognosis is that most people experience mild skin lesions treated effectively with topical therapies. It hurt quality of life. Patient experience physical discomfort and some disability. Itching and the pain can interfere with the self-care and sleep. Participation in the sports. Certain occupations become difficult if the plaques are on the hands and feet. Plaques on the scalp can be mistaken for dandruff. Poor self-image, fear of the public rejection, depression and social isolation, and suicide tendency is there. There is common belief that psoriasis is contagious, which is wrong, and that is the end of the lecture. I have given the very comprehensive about the psoriasis, and every aspect of the psoriasis has been covered. If you like, so please subscribe and like and share it with the others. If any question, please feel free to ask at my numbers given. And thank you very much for the patience. listening and watching. Thank you.